Hi, I'm Nicole Hernandez and I'm a doctor of physical therapy and mattress reviewer here at NCOA Advisor. And I'm here to talk to you about some of the best sleep positions for back pain and neck pain. Now, it can be really difficult to find relief at night when you have back pain or neck pain, especially when you're just trying to relax and get a good night's sleep. And I've treated plenty of patients that have lower back pain and neck pain, and they all require a different approach because everybody is different. Before we get going, I want to let you know that this video is intended to give you some tools for your toolbox so that you can get better sleep. It isn't intended to be medical advice for your specific condition. To work towards more long-term relief and to rule out any red flags, make sure that you talk to your doctor. And also make sure to bring up if you need to see any other medical professional, like a physical therapist or a chiropractor, to manage your symptoms. In a lot of cases, sleep positioning can help, but usually you need to consider other things like nutrition, stress, and exercise. But before we start, make sure you subscribe and then let's get going. A number of different provoking factors can worsen lower back pain. Sometimes they're mechanical factors or things we physically do to cause pain, like bending, walking, and lifting. And for some people, lower back pain can coincide with sciatic symptoms, like pain or numbness down the leg into the thigh, calf, and sometimes even the foot. If you're unsure what yours is, make sure that you talk to a physical therapist and get evaluated. Once you find out which positions and which movements are provoking, you can usually find the ones that are most relieving. Neck pain is similar. For example, a common mechanical factor that provokes pain is turning your head to check your blind spot when you're driving. So if you're unsure which movements spark your pain, make sure that you ask your physical therapist. Now it's time to talk about different tips and tricks to get comfy in your favorite sleeping positions. But remember, these tips and tricks might not all work for you, so pick and choose which ones are best for you. And don't forget to collaborate with your medical professional. If you love sleeping on your back, here are a few ways that you can get comfortable. If you feel your hips tilting forward when you lay on your back, which makes you arch your back uncomfortably, you can fix this by placing a pillow under your knees. This takes the slack off the muscles in the front of your hips that were pulling forward on your pelvis. And if you feel like your lower back is sagging into a soft mattress surface, get a small pillow or roll a towel long ways to add extra support to your lumbar area. You can also get a lumbar pillow specifically designed for this. This maintains the natural arch in your spine, which can be really comfortable. I've also seen success with this accommodation. If you have a day of sensitive symptoms with tension in the lower back or even down your leg, try getting a thinner pillow under your head or removing it altogether. This could remove some muscle or nerve tension running along your back, which could do the trick. First, check your pillow height. It could be too high, causing your chin to tuck towards your chest, stretching the back of your neck. In this case, switch your pillow for a lower one. You could also try a specifically contoured pillow if your neck feels unsupported under its natural curve. However, I've found that these pillows can feel intense depending on the density and your tolerance for built-in neck support. If it's too strong, it can tilt your head backwards all night, like you're always looking up. And for some, that's actually a provoking movement. So before you purchase a pillow with built-in neck support, experiment with a rolled towel under your neck, or maybe consider a latex or a memory foam pillow that better contours and supports your unique curves. Now, if you love sleeping on your side, which is the most common way to sleep, there's a number of ways to make that more comfortable. One of the easiest ways to find lower back pain and sciatica relief is by placing a pillow between your legs. This works by neutralizing the position of your pelvis, which also neutralizes your spine's position. Also, some people experience worse sciatic symptoms when the affected leg crosses over the center of your body, almost like crossing your legs. And laying on your side with the knees together is pretty similar. Adding a spacer between the knees can remove the tension that provokes symptoms. For those of you with an old or soft mattress that sags throughout the night, you may find yourself in a side bent position, which can spark symptoms if that's a provoking movement. I'd suggest replacing your mattress for a more supportive one, especially if your symptoms have been around for a long time. But if you're holding off for now, try placing a thick rolled towel, lumbar roll, or pillow between your ribcage and your hip to get into a more neutral position. I also want to point out that flat surfaces can feel unsupportive too. When you lay on a relatively flat and firm surface, your body is flatter on the bottom side and crunched up top, which has a similar effect to a saggy surface. Using a pillow or a rolled towel under your body is also helpful here, but you might notice sharper pressure points at the hip and shoulder. It's better to find a softer surface or get a mattress topper. Fixing your pillow height is key to neck comfort inside sleeping. You need a pillow that fits between your ear and the mattress's surface, not too tall and not too short. If it's too tall, your neck will feel crunched upward, and if it's too short, your neck will feel crunched downwards. Sometimes these positions can be subtle and can be fine for non-symptomatic people. But if your pain is active, this could be enough to wake you up at night and leave you painful for the next day. You also want to check that your pillow is holding its shape. Maybe you have the perfect pillow, but if it changes its shape as you settle into it, you could end up all bent out of shape. I like to recommend latex pillows here, but I'd stay away from down pillows because they compress quite easily. Die-hard stomach sleepers, don't worry. You don't have to sacrifice that position if you have low back pain or neck pain quite yet. Some people find a lot of relief laying flat on their stomach, and for many stomach sleepers, it feels like a really safe position. If you're someone who loves stomach sleeping and no longer finds it comfortable because of a new injury, there are still ways that you can tweak your position and get a good night's sleep. If the all-flat position feels too extreme for your back right now, try placing a pillow long ways or short ways under your body. Whichever way you try, make sure the pillow supports your hips because that influences your lower back position. Some people also find comfort and relief by adopting a frog leg position with one leg up and one leg straight. I don't specifically recommend this position clinically because it's hard to hold the position all night, but for some, it could at least help you relax enough to fall asleep. Now, neck pain is the most common reason clinicians recommend getting out of this position. That's because you need to turn your neck all the way to the side to breathe, otherwise you're face planting into the pillow and that's not ideal. But turning your head can be a provoking factor for many with neck pain or a pinched nerve. So what's a stomach sleeper to do? First, assess your pillow choice. If your neck is turned to the side and cranked upward, that can be provocative. Instead, opt for a flatter pillow that compresses well, like one stuffed with down or down alternative. Or just remove it altogether. That removes the upward pressure, which should already feel much better. And as an added bonus, try nestling your chin towards your chest to get fully out of that extended neck position. If the rotated position alone is uncomfortable, hear me out. Bring back the pillow. But this time, sleep at the edge so your neck unravels out of the fully twisted position to only about 3/4. Usually symptoms are worst at end ranges, so if you can get out of that end range, you might feel better. Lastly, try rotating your neck to the other side. It may not feel natural, but if you only have symptoms rotating your neck to one side and not the other, it could be a good fix until you can tolerate your old position again. Now, if you flip around all night, I encourage you to ask yourself why. Is it because you're uncomfortable in another position, or is it just because you're an active sleeper? Regardless, if you do move often in your sleep, you want to make sure your surface makes it easy for you to do so. My biggest recommendation is to assess your sleeping surface and ask yourself if it's time to change your mattress or even your pillow. If your mattress is older than 10 years, it's probably time, especially if you move frequently because you're uncomfortable. If you do need a new mattress, find one with good functional support. And what I mean is a mattress that is on the firm side with a good amount of surface support, offers reinforced edges that protect you from falling off the bed, and is bouncy and responsive to boost your mobility. And if you always have been and you always will be an active sleeper, make sure that you get a mattress that encourages your movement, because otherwise you're just fighting the material, which can lead to interrupted sleep and maybe even be painful. I hope I gave you some ideas to try out, but please remember to talk to a healthcare professional about getting a thorough evaluation that will reveal your specific pain patterns. And remember, you are your best advocate, so get the answers that you need. Make sure that you comment underneath this video and let us know what's worked for you. Thank you so much, and make sure that you subscribe and like for more. Bye.